Axial compression, how the spine handles vertical loads. Axial compressive forces act along the vertical, longitudinal axis of the spine and are perpendicular to the intervertebral discs. Common situations that generate axial compression include gravity, ground reaction forces transmitted from the legs, muscle contraction around the spine, ligament tension, carrying extra weight on the head, shoulders, or in the hands, normal body weight of the head, arms, and trunk. Structures that resist compression. The main structures resisting axial compression are vertebral bodies, intervertebral discs. They bear the majority of the load. Other structures also contribute: facet, zygapophyseal joints, which can take 0 to 30% of the compressive load. Spinous processes, especially in extension when they contact each other. Role of the intervertebral disc. The intervertebral disc behaves like a fluid-filled balloon. When a compressive load is applied, the nucleus pulposus, central, gel-like core, tends to expand in all directions. It pushes outward against the annulus fibrosus. It also transmits forces to the vertebral endplates above and below. In a healthy disc, there is a balance between pressure in the nucleus, resistance of the annulus, and support from the vertebral endplates. This equilibrium prevents abnormal bulging. Vertebral bodies. The vertebral body is made of trabecular, cancellous bone surrounded by cortical bone. The trabecular network helps dissipate compressive forces. Forces transmitted through the endplates are distributed inside the vertebral body. With age and loss of bone mineral density, trabecular bone becomes thinner. The vertebral body is less able to withstand compression. Risk of endplate or vertebral compression fracture increases. Creep phenomenon and disc fluid movement. The intervertebral disc is a viscoelastic, water-rich structure. Its behavior depends on the rate and duration of loading. When a load is applied for a short time, the disc deforms elastically and returns to its original shape once the load is removed. When a load is sustained for a long duration, e.g., standing or sitting for many hours, carrying weight on the head, water is slowly expelled from the disc into the adjacent vertebral bodies. The disc height decreases slightly during the day. At rest and during sleep, water is reabsorbed and disc height is restored. This cyclic loss and gain of water explains why a person may be slightly shorter at the end of the day and slightly taller again in the morning or in microgravity conditions, e.g., astronauts. This is a normal physiological process called disc imbibition and creep behavior.